The substance we're talking about today is like that particular drink in that famous local commercial. Can I have some?
Yes, but not too much. You're talking about that drink that's this color.
That's right, I am. And we are talking about cholesterol today, the good and the bad. All of this on
Everybody Knows.
Welcome to the second season of Everybody Knows. My name is Mike Kasem.
And I'm Catherine Robert, and today we're talking about cholesterol, or more specifically, the effects of cholesterol.
Helping us make some sense of it all, we have cardiologist Dr. Devinder Singh.
Welcome to the show.
Hello, hello,
Coming
hello.
out, coming out.
Thanks for coming on.
Hi, thanks for coming on the show.
That's a strong grip, dude.
That's right.
It's great to have you on, and it's perfect because I happen to be on cholesterol medication, so
Are you?
got a lot of questions. Yeah.
Wow.
Yeah, so, like, what is happening when you have high cholesterol?
Okay, so maybe let me start by telling what exactly is cholesterol. Cholesterol is a waxy fat-like substance, and it's actually essential for our body. In fact, before we start bad-mouthing cholesterol, we can talk some good stuff about it.
Okay.
So every cell of our body has cholesterol.
Oh.
And in fact, some of the hormones, testosterone and estrogen, actually requires cholesterol for formation. And majority of our cholesterol is made up by our liver. But when we have excessive cholesterol, then it becomes a problem.
Yeah.
It starts clogging your blood vessels and can start causing something called atherosclerosis, or narrowing of your arteries.
I'm confused. I thought cholesterol was something you eat.
Okay, our body cholesterol, only 20% is contributed by diet. Rest of the cholesterol is actually made by our liver, 80% of it.
So that's why even with a healthy diet, or some people who are genetically disposed,
Will have high cholesterol, even if you are eating extremely healthy.
How many people, what is the percentage of high cholesterol in Singapore?
The National Health Population Survey, which was conducted in 2022, showed 31.9% of our adult population has high cholesterol. So that's like 1 in 3. So the question comes in, how do we measure cholesterol? So there's a test called lipid profile.
That's where you say you got good cholesterol and bad cholesterol,
Correct.
right?
Yes.
LDL, HDL.
Yes. So when our liver makes cholesterol, it's actually insoluble in fluids because it's fat. So liver has to pack up it in tiny packages. Those packages are called lipoproteins. And that's how the liver sends cholesterol to the rest of our body through circulation.
Right.
And when we are checking cholesterol or lipid profile, there are many fractions of cholesterol. One is called LDL, which is low-density lipoprotein. So we can call it L for lousy.
Okay.
But L also stands for lowering it.
Do you need some of that, though?
We do need, but not excessive of it. And then there's something called good cholesterol, or HDL. HDL stands for healthy, or H, and also higher. Apart from that, there is a third fraction called triglycerides. So triglyceride is the way the fat is transferred in our body. That means once we eat our meal, every part of the fat is actually transformed into triglyceride and sent to the liver. And the liver starts making lipoproteins from them and sending it to the rest of the body.
They're a good thing?
No, in excess also is bad.
All right, guys, why don't we now welcome a couple of celebrities who are definitely familiar with the topic of cholesterol.
He kickstarts your day with the Breakfast Club.
And he speaks all 4 of Singapore's official languages.
A big welcome to DJ Gerald Koh and actor and presenter Das DD. Hey, where are they?
Oh, this way,
Were you too early?
Hello,
Wrong side, is it?
No, see, welcome to the show.
Hi, guys.
Hi.
Yeah,
So y'all are familiar, is it, with cholesterol?
Well, for me, my dad has got. My
okay.
father-in-law has it as well, so a little bit familiar, I guess.
I guess this is interesting that we're having 2 young guys on here, but I mean, it's something that you guys will have to eventually think about. I mean, I hope you never have super high cholesterol, but, you know, it's just something you have
I
to
think
think
it's a
about.
bit too late for that because when I went for my national service blood test, they actually said that I have hyperlipidemia. I don't know if that is...
That's the term for high cholesterol.
Yeah, so but then it wasn't very serious. I still got to get a combat PET status, which means that I'm still active.
Okay.
But I'm not sure what the implications are. And I think it is hereditary.
Yeah.
And it is quite predominant in the Indian ethnicity as well, is what I heard from doctors. Is that true?
South Asians, including Indians, Pakistan, Bangladesh, actually we have a higher risk of elevated cholesterol, mainly genetically as well as partly because we have a very carbohydrate-based
Diet.
diet.
And thus, you were saying that you got it, but you look very healthy and all. Can you actually reverse cholesterol?
But looks are deceptive.
Okay.
So you can be really skinny and you can still have high bad cholesterol or LDL.
If someone is obese, does it mean that they would definitely have high cholesterol?
Although obesity is a separate risk factor for cardiovascular disease, but weight may not have any bearing with your bad cholesterol.
Right, right.
'Cause
You know, I got something to admit.
Yeah.
You know how you do your yearly health screening and stuff like that? My LDL always comes back high, and the doctor always says, you need to look after your LDL, you need to look after your bad cholesterol. And is that a cause for concern?
Yes, it is,
Oh, no.
unfortunately. But we just can't look at cholesterol as a number. We have to look at your overall risk profile. That means we have to individualize your own risk, and then guidelines help us to decide how and what way we treat it.
So another thing that I wanted to ask, so I've been trying to be on this like fitness regime, I'm in a fitness era now.
Ooh.
And so like a lot of these, adverts, they always say, oh, you have a high protein diet, right?
Yeah.
So one of the most easiest ways to consume protein is to eat eggs. But I heard eggs are high cholesterol as well.
Yes, the yolk.
An egg a day is not really harmful, but the yolk of the egg has about 200 milligrams of cholesterol. There are some good nutrients. So, but remember, I was telling you that 80% of your cholesterol actually comes from your liver. It is not coming from the yolk you are eating. So, if you are having a single egg yolk a day, is not really harmful.
Yeah, but is it different for different people? Like, for example, maybe she can take 2, I can take 3. How do you know that?
That's a very good question. Depending on your lipid profile, how your LDL is, how your genetic risk is, actually, that is about individualizing your own risk rather than just deciding it as a population number.
Okay.
You can have 3-4 egg whites to have more protein, but egg yolk is advised to have just single egg yolk a day.
I didn't know it was your liver creating that, and so you and I think, have the same issue because it's genetic.
So what am I supposed to do to...
You have to look at it in totality, What is your family risk, What is the risk of having a cardiac event in next 10, 15-year risk?
Right.
Can be assessed by your healthcare provider by taking a good history, knowing whether you are a smoker, whether there's history of diabetes, hypertension, at what age your parents had any cardiac event if they had. So all those things will help us decide to individualize your own risk.
I just wanted to pick up on that. So would you say, because I got my heart all checked out, and amazingly, even though I've had high cholesterol and not been on pills this whole time until recently, would you say that my healthy diet helped?
Yes, definitely. We should start looking at diet not based on our cholesterol result.
Okay.
So the benefit of diet, exercise actually goes beyond all these numbers. So your blood pressure, sugar level, your muscular health, and your organ function and all depends on how physically fit you are in totality. But sometimes we get disheartened, I have exercised so much, I'm looking after my diet, but my LDL is still very high. So don't get disheartened by that number.
Yeah.
So the benefit of exercise, diet control goes beyond all these numbers.
Okay.
How young can you be to take these cholesterol tablets?
Statins.
Yeah. So if you are adult, like above 18 or 21.
So my age, 21 and above.
You can start
Okay.
statins or cholesterol medication. In fact, if there's a condition called familial hyperlipidemia, where you are genetically predisposed to have really high cholesterol, and it's not about your diet or your lifestyle, it's your liver making it, it can go really high. And you can start getting atherosclerosis or blockages even in your 20s. So in that scenario, we really have to start you on statins at a much younger age to reduce your future risk.
So far, I'm trying my very best to understand. Statin, you're saying, that helps the liver?
Statins is a drug which is taken orally, and it goes in and tells your liver to make less cholesterol.
Statin is like artificial, right? Is that something that you can eat that can really help?
Diet only contributes to a very small fraction of your cholesterol levels. So even if you are trying by diet and other means, eventually there's something is required that tells your liver to make less cholesterol or tells your intestine to absorb less fat. That's the two way we can reduce your cholesterol.
I tried, it was more of like a fruit juice diet.
So fruit or fruit juice is again sugar.
Yeah.
So if you are having a lot of fruit juice a day, in fact, to get a glass of orange juice, you have to squeeze like 3-4 oranges.
Yeah,
So imagine the
more.
amount of sugar you are consuming,
Yeah.
and without any fiber.
So we should eat fruits, but not in the form of juice.
Correct.
Honestly, this topic is stressing me out. And before I get stressed out even further, how about we continue this discussion later? But for now, we have a cholesterol quiz that, by the way, is going to run throughout the entire show, okay?
That's right, and we're going to give you a statement, okay? And you're going to tell us whether it's true or false, and we're going to be tracking your scores throughout the show, and we're going to announce the winner at the end of the program.
Okay.
That's right.
All right, so here comes the first question. Thin people do not have high cholesterol. True
Thin
or false?
people do not
Okay,
have high
we got them all in.
Yes.
Could we all possibly be wrong? We will find out right after the break.
Alrighty, welcome back to Everybody Knows, and it's all about cholesterol today, and our expert cardiologist, Dr. Devinder Singh.
And we have been getting tired holding these signs through that whole commercial break. So what was the question? Let's give the question again.
Question was, thin people do not have high cholesterol.
And we all locked in our answers.
False.
It appears that you guys were paying attention to the earlier discussion,
Yes,
and you are all
exactly.
correct.
Yay.
Okay, so
Cholesterol is something that is not really related to your weight. It's genetically determined.
To confirm that, whether I have high cholesterol and it's due to genetics, do I need to get my whole family tested?
If you have really high cholesterol, that means your LDL cholesterol is way beyond the usual normal limit. Then we will be worried why you have such high cholesterol at this age. And then there'll be a list of questionnaires which can help us determine whether you have familial hyperlipidemia.
Okay.
And if you really have, then there are genetic tests that can be done to determine what kind of gene is involved that is causing this. And that particular gene, if you have, we can test rest of your family members.
Right.
We're talking about tests and everything. So how often, I hear that, you do it annually, right? Is that good enough?
After 40, it is recommended that you should have an annual checkup, including lipid profile, liver function, sugar, and all those things. But if you have elevated cholesterol and if we are doing any intervention for that, then yes, we have to check it in 4 months or 6 months to see the benefit of that effect.
are there any other contributing factors, like maybe diseases, things like that, that can...
That's a very good question. Inflammatory diseases like systemic inflammation, like diabetes, too high saturated fat, smoking, alcohol, obesity, certain medication also can lead to high cholesterol level.
That is wild. So we're looking at this slide here. We got sedentary lifestyle. How much does that play?
You know, if you are doing at least 150 minutes of cardio a week, you can reduce your cardiovascular risk. But don't look at cholesterol as a number then, because diet and exercise is contributing to your health, but not through lowering your LDL.
To put on muscle, I understand the importance of muscle, but because of that, can we completely not do cardiovascular activities?
You do have to have a good muscle strength. So, you know, focusing on strength training, core workout, and cardio. It has to be all three.
It has to be all three. So we cannot just go to the gym and...
But if you are doing rapid sets during strength training with shorter breaks, your heart rate will go up. So that it also involves like high intensity interval training. You are doing body weight exercises during that training, you know, like burpees. You are working on your shoulders, you are working on your legs, but your heart rate is also going up.
So for me, when I'm in the gym and I'm lifting my weights, I look at my watch all the time, and when my heart rate I don't let it drop below 125. I don't even count the time between the sets. So I just look, and when it gets to like 130, 125, it's like, okay, it's time.
Mike, you're doing the right thing, actually.
Yeah, okay.
So not letting your heart rate to cool down is actually doing like a continuous cardio. And you will have a bit of burst when you are, you know, lifting weights. It may go up to like 140, 150.
It goes higher, yeah.
Yeah, and then you come back to normal. So that is your cardio while you are doing strength training.
You know what? Thanks, Doc. And now I think it's time for question number 2. Currently, Gerald and Das both have 1 point each. Doc, we're ready for question number 2.
All right. I will not be able to feel it if I have high cholesterol. True or false? So
I can't be like, oh, I think I have high cholesterol.
Yeah. True. Doc.
How we doing?
well, you are all correct, There are clinical signs of high cholesterol, but not everybody manifests those signs. Can you see that eye with that grayish circle around the
Yes.
cornea, the first on the left? That usually you see in elderlies, but if you are young and you have that, means you have high cholesterol. There's something called tendon xanthomas. You can see the deposit of cholesterol on your tendons on the hand.
Wow, this is pretty severe.
This
right?
is severe. And this condition called xanthelasma, you might see it as small deposit of cholesterol around your eyes.
That doesn't look small.
This is very prominent in this picture, but sometimes it could be just small 1 or 2 single spots.
Okay, for getting it right, by the way, guys, there are some pins here. Every question you get right, you take a pin.
What does
You
it say? You are my soy mate.
Love you from my head to my toes, and it's a tomato.
Okay, look, it's time to take a break, guys, but when we come back, it's question number 3.
That's right. And we also have a story to remind you that high cholesterol doesn't just happen in your senior years. We'll see you soon.
Welcome back to Everybody Knows, and the hot topic is cholesterol, and answering our many questions is cardiologist Dr. Devinder Singh.
That's right. Gerald and Das are our guests and quiz contestants, and currently their scores are 2-2.
2.
But first, let's take a look at how this 49-year-old decided to go further investigating his high cholesterol.
Hi, I'm Yong Liang. I'm 49 this year, and I have a history of high cholesterol, gastro reflux, as well as hyperthyroidism. I go for regular health screening yearly with my wife, and I think since 2020s, every year the cholesterol has been high. My weight has been kind of ballooning for a couple of years, slowly it's creeping up. So after the health screening, the doctor in the review session told me, hey, you should lose some weight. At the same time, I was like, okay, my cholesterol is high, right? I'm wondering why it's always high and whether there's any underlying conditions inside that is not reviewed in the health screening. So then I asked the doctor, say, hey, can I go for scanning of the heart to check if there's any clogged arteries? So that's where I set out to look for a cardiologist, and so I found Dr. Singh, reviewed with him the health results, and he decided, okay, let's go for a calcium CT score scan, which I did. And it turns out that there's a number there. Although it's low, it's below 100, I think it was 37 or something. So to him, it's like, hey, if there's a number, it means already there's something, calcium deposits in the artery, so it will only grow. It will not fall, and there's no way of getting them rid of them. I wasn't shocked. I had a family history of heart diseases. Right? I was saying my dad, he had high blood pressure when he was 30. At 40, he had diabetes. So I wasn't surprised. I was kind of in this mode, right? I realized that, okay, I should do something. So I decided that, yeah, I should make a change. So thereafter, I've been on statin since with Dr. Singh. At the same time, I've been exercising regularly. I try to run maybe 4 or 5 times a week. And also, I really cut down on my carbo intake. My wife, Diana, who cooks every day, she's getting very frustrated with me because she cooked like half a cup of rice and we still cannot finish, 4 of us. But yeah, I think after a while also you get used to it. The body got used to it. So I think collectively it's helped. I've brought my weight down from 86 now to about 77, 78. So it's pretty good. I feel good. I feel energized. So there's a 400-meter track behind, so I have no reason not to exercise. I will run about 3 kilometers at the back. I try very hard to ensure my heart rate is high, at least 15-20 minutes every day. Like I said, right, we hear of people collapsing, without knowing, and I know, right, these blocked arteries is a silent killer. Many times, it's caused by high cholesterol, really very rich food intake. I do believe in the notion of we are what we eat. I do know that, yeah, high cholesterol will have an impact on your heart health. Physically, I don't look that bad, right? But in fact, there's a problem. You know, it's a small problem, minor problem, but there is a problem. So everybody should really watch out, and I encourage everybody to go have a quick check.
Dr. Singh, so he actually checked his calcium CT score. What's that?
You know, if you want to know your individual risk, just looking at LDL as a number may not be enough sometimes. Let's say you just have elevated cholesterol, no diabetes, not a smoker, no family history of heart problem. But where do you stand then, you know? Is your risk low or high? So CT calcium scores sometimes can help us tease out your individual risks. So to describe it, you know, once you start getting fat deposit in your arteries, in the beginning, it's soft like butter. But slowly it hardens. That hardening is your calcium score.
So are statins the only way to lower bad cholesterol?
Statins are the mainstay. That means they are the number one or first line. But there are some patients who are intolerant or have side effects from statins.
Okay.
So in that case, we can have alternative or non-statin options. One of them is a class of medication called PCSK inhibitors.
Okay.
These are monoclonal antibodies which have bi-monthly injection, and that can lower your cholesterol as effectively as statin. Another class of drug called inclisiran. Inclisiran is a small piece of RNA that is injected every 6 months. And it also tells your liver because it's a piece of RNA, it just goes and fits into your liver cells and tells your liver cells to make less PCSK. So every 6 months you get a jab, and the efficacy is as good as having statins.
So why are statins the preferred?
The statins are preferred because long safety record, lot of data, evidence-based, and cost.
Right, okay.
So if you talk about PCSK inhibitors in form of bi-monthly injection or even a 6-monthly injection of inclisiran, the cost is still much higher.
Right.
You have mentioned a lot of different medications, right? What is the cost for all of these very high?
I think the oral one is not.
Oral one is not expensive. In fact, they are all subsidized. And if you are seeing structured hospital or polyclinics, the cost of statins is really low.
I think it's very important because a lot of people will be very concerned over like the cost of things. Yeah.
Well, thank you so much, Dr. Devinder. And to close out our show, we have our third and final quiz question for Gerald and Das.
Not just them, I'm playing it too.
If I take medication for cholesterol, I can eat everything I want.
If I cannot eat anything that I want, then what's the point of taking the medication?
That's
so I
true,
say
right?
true.
Okay.
No, but I want to be a good student, so I say false.
It's false.
Yeah. So yeah, it is false. As I mentioned, you know, you do have to have moderation. You can have good food. It's just that you can't have too much good food.
All right, I guess the winner out of this game is me because they got it wrong.
Yeah.
So there you go, I won the game.
All right, well, we'd like to thank so much our Dr. Devinder Singh here for his expert advice today, and our celebrity guests, Gerald Koh and Das DD.
Yeah, that's right. Thanks so much for watching Everybody Knows, and please head on over to MeWatch for our Doc Can Tell Me Why series, where we'll discuss supplements and foods to do with cholesterol. See you next week. Bye-bye.
Bye.